Before we dive in, here's an easy win for your health journey. Subscribe to our YouTube channel. On each episode, I share real-world medical guidance with my guests that's practical, trustworthy, and rooted in experience. It takes only seconds, so click that subscribe button now. My guest today is one of the country's leading ENT and facial plastic surgeons. His work includes aesthetic procedures like rhinoplasty and facelifts, as well as complex reconstruction. And he recently made headlines with a warning about the growing damage he's seen in patients who use cocaine. Facial plastic surgery, he says, is far more than a career. It's a calling. Welcome, Dr. Anil Joshi. Thank you for coming in.
Thanks for inviting me for this wonderful show here.
You're a very busy man, so I really appreciate the time. And the work you're doing is groundbreaking. Now, I've just mentioned there that you're seeing a lot of patients who've been damaged by the use of cocaine,
Yes.
which is obviously very widespread these days. Tell me, first of all, how is it? Explain to people, why does cocaine cause that damage to the septum, the partition in the nose?
Yeah. So cocaine has been regularly used by medical practitioners as a local anesthetic in the nose. So it has got some good use there. However, when it's gone into misuse, what happens is it causes vasoconstriction, or what we call as the blood vessels going smaller and lack of blood supply to that particular area, which can happen over weeks and months if you start using these medications or drugs on a regular basis.
Right.
And on top of that, there could also be nerve damage, which means, for example, if you start picking your nose, if there are crusts, you don't feel that. And when you start picking it and you're going to traumatize it, there's not much blood supply to make that area heal. So consequently, with both of these actions, you're going to lose a bit of tissue, and with that, the cartilage, which is the sandwich between the two lining, and then you start getting a small hole, which can then go bigger, and then we go into other problems.
Absolutely. And are you seeing a lot of patients in this situation?
Unfortunately, yes. I'm, in fact, also grading them into who they are. For example, when they first get in, I can see some congestion in the nose, irritation, lining looks redder, and then I start seeing small changes, and then that leads to the next stage of a hole on the septum, and that hole starts getting bigger, and over time, the nose also starts getting damaged. So people see collapse of the nasal dorsum or the top of the nose, and there could be deformities on the sides. And I've got a few patients who've got no nose left. Absolutely zero. It's a hole.
Shocking. And I know that you're very interested in the people themselves. It's not just, I've got to reconstruct this nose. You make sure that the people that you operate on are off cocaine. They have to be drug-free. Otherwise, what's the point?
Absolutely.
You make sure that has happened. And you want to build that person's dignity back, give them self-respect back, build them up as a person, which is refreshing to hear that, because we often think of surgeons as fix the organ, patient can go home. You look after the whole patient.
Yes, I say this again, even to my junior colleagues and people around. You've got to see that person, the human being in front of you. It's not just that organ, a tissue. No. Once you get that whole concept right in your head, and people see through that.
Yes. And
then the connection also grows better, and you have that nice relationship. They follow your instructions, and then the path towards the success is far easier.
Well, as a general practitioner, it's very pleasing to hear that. Yeah. That's what we try and do as well. How do people get referred to you? Do they find you, or are they referred to you through the NHS?
Yeah, I work both in NHS as well as in private. In private, of course, either word of mouth or with people looking at my websites or my social media, or colleagues referring people to me. and of course through NHS. GPs,
of course,
there's a lot of people in the neck of the wood of where I work. They refer me directly.
And this is just a tiny part of your work. I mean, you treat people who've had surgery on their faces for cancers, like sinus cancer.
Yes.
You see people with trauma. They've lost part of their facial structure, ears. What do you find yourself doing mainly?
A combination of all of these,
all of that.
Really. And that is the beauty of, again, not just concentrating on one bit, however, concentrating on the face itself. I don't go anything below that.
Okay.
And so work mainly on a lot of skin cancer works, which I get referred from my dermatologists, and I cut the skin cancer out, and there's going to be a large defect. I reconstruct those things. And in fact, even today, this morning, I finished my clinic and had a 90-plus-year-old lady who walked back into my clinic after having reconstruction. And thank God it looked completely normal. And she just held my hand and she said, I'm ever so grateful. And nothing can replace that.
No.
And so that is one of those.
That's wonderful. That's wonderful. And things have come on in leaps and bounds since. I mean, I suppose we look back at the two world wars. Some of the worst injuries involved the face.
Yes.
People would not be able to go out in public. They were so disfigured. But is there a limit to what you can achieve these days? And what's the future looking like?
Yeah. Well, there's always a limit in terms of how much surgical that you can push. You can't just replace the whole face or the whole head. So therefore, we are now getting into reconstructions with 3D printing and stem cells. For example, right now I'm in the middle of writing up a book chapter for one of the main textbooks for ear, nose and throat in auricular reconstruction, where we are focusing on the future technologies and things that we can incorporate into these.
So if someone's lost an ear, you can
start growing it.
Okay.
Still, it's in the lab, but future is bright there.
Yeah.
We've got to be positive, and we're going to reach there.
We were talking earlier, and many years ago, I interviewed a lady called Christine Piff, who wrote a book called Let's Face It, and she had a sinus cancer, and she was able to rebuild half of her face with building blocks, which were then covered in latex, and then she would apply makeup, and it was a brilliant, absolutely brilliant result.
Amazing, So that's where we are going to pick up the pieces from how things have started and then move forwards with the latest technology, involve AI, and formulate what the dimensions are. Currently, sometimes with some of the new prostheses, it could look a little bit fake, but then we are on the improvement.
You mentioned 3D printing. Now, for the layman who can't imagine how that can apply to the human body, the face, tell me about 3D printing. How does that work?
So essentially, the whole face is a three-dimensional structure. Ear itself is a semi-area in that, which is three-dimensional. Same thing with the nose, the whole face. So essentially, we are going to take pictures from all angles or the scans, and then integrate all of these together and then conceptualize how the next ear can be made. And then we can utilize these into the technology, and then that will help us exactly get the measurements, the angles, the analysis, the color, the texture, everything, and which is going to be superb.
Yeah. But you did say also earlier that AI is not alone going to be the future of medicine, because we still need to interpret the results. We still need to think about the patient, what they want. And this is where a bit of art comes into the science, isn't it?
Exactly. So there's only so much AI can push for now. Of course, none of us can predict the future. However, right now, for example, I get a lot of patients when I do my primary surgeries, which are rhinoplasties, and they say, hey, can you morph this picture and show me how things are? Of course, I do that and I show them. However, I also say that a kid can do a better morphing than I, but they can't do the surgery.
Yes.
Yeah. And secondly, the other confounding factors, such as your blood levels of hemoglobin or, oxygenation, whether you smoke or drink. We all know that smoking hinders the healing power by 12.5 times. Computer is not going to be managing all of those points.
Yes.
And your immune status. There are a lot of these factors. Just the realism of AI is not going to demonstrate you the exact picture. So which is why we come into the focus. And thirdly, we also have to, my mantra with my plastic surgery is keep the beauty natural, but enhance it rather than going overboard. And which means that we just have to go back a little bit and lean back rather a little bit.
Yes.
And then a lot of our patients, they like that.
Yes. Now, you come from a family from Bangalore originally.
Yes, indeed.
And your parents and your grandparents were very talented. Your great grandmother was a scholar.
My great grandfather
was
and also a grandfather. Both were eminent writers back in India.
Okay.
They've passed, but they've written multiple books for the society.
And when you were younger, you were an accomplished musician. You had a band with your brother, with the Joshi brothers?
Yes, indeed. So we were playing on stage all the time. I was playing on violin and they were playing on another string instrument, another brother on percussion. And it was good fun. We recorded a few albums.
Did you?
And it was all good fun.
I bet.
Now integrating that into my medicine is the focus.
Well, you told me that you had to decide because you were so busy. You were interested in medicine, very interested in medicine. It was a passion that you had, but so was music. But you couldn't do both. I mean, it was both full on careers, and you chose medicine. Yeah. Has the artistic part of you helped with your medical career?
100% right. It has. Because with surgery, regular surgeries are fine, but when you're looking at the three-dimensional setup and the eye for the aesthetics with the patients, what they are asking for, and on the table also, where to stop, where not to go, all of these, it's not just the copy-paste answer from each surgery.
No.
And every surgery is a bespoke surgery here. And for that, it's like you using your eye for photography, getting the taste for filming, music, and all of those which I'd had experience in the past. And I could channelize them into my facial plastics, and which is one of the reasons I chose this field, where I could integrate my medical skills with the artistic skills and give a better result.
And you've been registered as in this speciality around the world.
Yes.
But it can't have been easy leaving India and coming here and breaking into the medical world here, doing what you're doing now.
Everything is a challenge in life. And once you embrace the challenge, pick it up, fight, work towards it, and then you get fruits in a better way. So it's, I just love it.
I bet. And so you're doing all kinds of facial reconstruction now. Yeah. What do you enjoy doing most? What's most satisfying?
My primary ones are rhinoplasty surgery, or the nose job we call. And these are quite complex. It's not just shaving the hump off, just getting the tip a bit stronger. Each case comes in with its own challenges and stuff. So with such cases, every day you innovate and you improve upon things. So that is one of the things that I really enjoy. And secondly, working on elderly patients with a large amount of skin cancers and reconstructing their faces. As I say, they come with a lot of comorbidities. And some of these are, very hard on the table. But you just change your path a little bit into plan B or plan C, and then manufacture those accordingly.
Yeah.
And so I really enjoy going to different flaps and skin grafts and so on and so forth. So it's really good. And these are the two that I'd really find challenging, but love it.
It's quite different, isn't it, looking after a skin cancer on the face than to anywhere else, because it's so visible. And if it's around the delicate area around the eyes, the nose, there isn't much skin to deal with. So it must be a challenge.
It is a challenge, and therefore I also, again, coming back to one of the points, I say to my junior team, I run a fellowship program. My fellows assist me for these cases. I say for each of these kind of defects, for instance, have at least 3 or 4 different variety of surgeries under your belt, so that you discuss all of these with the patient and see what you can tailor-make on the table later on. Because if you have just one trick, you've gone. So it's that challenge.
I bet. How would you distinguish between what we call plastic reconstructive surgery and aesthetic surgery or cosmetic surgery? I think the lay public often see that as a blurred area. Do you see it in that way, or is there a distinction for you?
Well, you can't draw a clear line under the sand and say this is that and that is this, because for me it's a holistic approach of all of these together. For example, again going back to the rhinoplasty works, it's just not making a nose look really cute. What if you do that and they can't breathe, or it has no structural strength?
Yes.
So it's a conglomeration of all of these to mix together, and that is what plastic surgery is all about to me.
I mean, I remember reading a little while ago that there are cultural preferences. So in the East, everybody wants a bigger nose to look more westernized, whereas here we want a small button nose to look more cute, to use your term. So does that still exist? You know, that people want to change culturally how they look?
Some people do, but my preference is to keep your identity, both with how you feel inside, your culture, your race, your orientation or whatnot. And so it's more of your own feeling of identity. So that is why if someone asks me to change a lot, to something which I don't feel happy with,
you won't do it.
I would easily say no. And for me, I'm more at peace with that. And to approach with a bespoke, natural but enhancing ones to keep your identity is with the mantra which I always say.
Absolutely. But unfortunately, there are aesthetic practitioners who may not even have a medical qualification using Botox, using fillers, and we read about the effects of the damaging effects of some of that practice all the time. And just recently, there were over 30 people in the Northeast who were given a unlicensed botulinum toxin for wrinkles, who developed botulism. Couldn't swallow, having respiratory failure. So that's a worry, isn't it? And the medical tourism, people going off to places like Turkey, I think there have been something like 40 cases of life-threatening side effects or even deaths as a result of people choosing cheaper surgery. This is something that demands better regulation, doesn't it?
100% right. And we are fighting towards that, trying to liaise with the Royal College and the government. And the keys for the patients also as a take-home message would be look at the doctors or the surgeons or the practitioners, their credentials and what they've done, what their educational backgrounds are. Are they into learning more and going to meetings? All of these, they do matter.
So that research is really important,
that
isn't
is
it,
important,
before you
really,
to go down that route. Excellent. So what's next for you in your career? More music or more science?
Maybe mix both.
Yeah, why not? Are you still playing?
I do still play.
The violin?
I play the violin.
Excellent.
And compose a little bit. I used to compose for short films, but now again I've taken the foot off a little bit.
Okay.
But then I'm also heavily involved in the European Academy's executive board of facial plastic surgery. So I'm currently part of that. And so we are conducting international exams, international meetings. The next one's coming up in Dublin in September, which I'm the chair for the scientific program. So there's a lot of things going on. But it's all exciting.
You're a busy man. And how do you keep fit and healthy?
I go for running. I go to my gym a couple of times a week, every single week. That is for physical ones. Some mental ones are also quite important. Mental fitness, stay grounded, listen to nice podcasts, good music, And I listen to a lot of meditation stuff, even when I start my journey every morning in the train or whilst driving. These are important.
Of course. And your job involves a lot of responsibility. People's life is in your hands.
Exactly. Yeah.
And you must need some downtime and just time to chill.
But, like, for example, some of the surgeries take 7 or 8 hours. And if you don't stay fit, you can't do them.
Yeah. So you practice what you preach.
Indeed.
And keep well. It's been a privilege.
It's my pleasure.
Don't forget you can watch all my interviews on the Dr. Hilary Show YouTube page, including my recent conversation with Pete Cohen.
Yes, my wife passed away in 2023. She was given 18 months to live in 2011. And you were one of those people that I turned to. And I asked you for your advice. I asked, what should I do? And I never, ever forget what you said. You looked at it and you came back to me and you said some words to me that just gave me the encouragement to take a step that gave my wife extra years of life without a shadow of a doubt. And I've shared that journey with you all the way.
Well, I can't take any credit for that, Pete, because you supported and loved her, looked after her, researched relentlessly for the best treatment she could possibly have, and you gave her those extra years, taking her not only to Mexico but to Germany as well. She, of course, had a brain tumour, which was inoperable.
So the first brain tumour that she had in 2011, she had surgery at the Royal Free. She had 8.5 hours. They did a wake surgery, because of where the brain tumour was. They woke her up and they stopped when her language started to change. So they weren't able to remove all of it. It was an astrocytoma, grade 3. She had radiotherapy, but the tumour came back quite quickly. And I found this treatment. Actually, it was in Houston with this Dr. Basinski. As you know, huge amounts of controversy about this doctor. It was very expensive. It was like over $200,000. But, this treatment was amazing. She was dying. I mean, she was dying. You could see it. And she made this ridiculous, incredible recovery. We had a second chance. We got married in 2014. We did. You came on my podcast many years ago. You met Hannah, and she knew what you meant to me because you were one of those people. I know you said you didn't do anything, but you were just there. And you've always been there. You've always been that type of person that has been incredibly dependable and incredibly kind. And it's, I'm very grateful to you. I know you say, oh, I didn't do anything. Yes, you did.
And before you go, remember to subscribe on YouTube now so that you don't miss what's coming next. We'll continue the conversation about your health and focus on what truly matters to you. And for more information and show notes on all our programs, go to drhilaryjones.com.